What's up guys? Today I'm going to go over my 4 top tips if you're dealing with low back pain. Before we get started, if you're looking for more information about training, rehab, or dealing with injuries, make sure that you subscribe to my channel below so you don't miss any of my future videos. Low back pain is an extremely common condition. It's estimated that about 80% of adults will experience it at some point in their lives, and it places a huge burden on our healthcare system. It can also be a quite literal pain in the ass. Do you see what I did there? No? Oh, okay. All right, let's get into the 4 tips. So tip number 1 is to make sure that you try not to worry too much. It's gonna be completely natural that when you're dealing with back pain, whether it's new or if you've had it for years and years, that you're gonna worry about it being something medically serious like cancer, fracture, tumor, things of that nature. The good thing about most cases of back pain is that most of them do not indicate a serious medical pathology. It's actually pretty rare for back pain to be a sign of something really serious going on. It's estimated that 1 to 3% of cases are actually medically emergent situations that would require immediate medical action. Not to mention that the more that you worry about this condition, the more anxiety it can produce and the worse your outcomes can be. So if you can make sure to try to relax a little bit, try not to worry too much about it, you can actually help yourself recover quicker and better. Tip number 2 is that you make sure to keep moving in some manner. The last thing that you want to do is just go on 2 weeks of complete bed rest, lay on your back, and not move at all. It's been found that not moving at all and being on complete bed rest actually makes people take a longer time to recover. So you need to find ways to keep on moving that's relatively comfortable to you. If that means going for a light, easy walk, then go for a walk. If that means doing some range of motion drills like a cat camel, a lower trunk rotation, knees to chest, that sort of thing, then absolutely do that. You need to keep on staying physically active and also make sure that you're moving your lower back through some comfortable ranges of motion. Tip number 3 is just basically an extension of tip number 2, and that's to make sure that you're continuing to exercise in some manner. Now, if you're a barbell athlete like a powerlifter, weightlifter, or crossfitter, you don't need to just stubbornly push through your symptoms and do your same training if it's really flaring you up. What you really need to do is modify your training so that it's relatively comfortable while still respecting the pain that you are dealing with. So if you're getting pain with things like squatting, instead of back squatting, maybe try front squatting or goblet squatting or belt squatting. If those axially loaded squats still bother you, you can switch to some sort of split squat or lunge variation. The same goes with deadlifting. If conventional deadlifting is really bothering your back, then you can try reducing the load, changing the volume, manipulating variables like that. And if that's not working, you can try switching to some other deadlift variation. You could try a sumo stance deadlift, pause deadlifts. You can even go kettlebell deadlifting or some other hip hinge based exercise. You don't need to completely give up your training if you are dealing with back pain. You do need to find ways to complete your training with a relatively comfortable level of symptoms. You don't need to push through 10 out of 10 pain, but it also is okay to have a little bit of discomfort while you are training if you are dealing with back pain. My last tip is something that a lot of you probably aren't going to want to hear, but it's stop Googling your symptoms. There is a lot of good information out there on the internet, but especially when it comes to pain and low back pain, there is a ton of really bad information as well. If you've been trying to deal with your symptoms on your own for a long period of time and it's not getting any better, or if it's really impacting your quality of life, or if you're worried that there might be something more serious going on, then instead of Googling your symptoms, please seek a qualified healthcare practitioner to actually evaluate you and see what they think is going on. If you guys thought this information was helpful, please hit that like button and drop a comment below. I'll see you next time.